PEPFAR, saving lives, investing in people. PEPFAR, partnering for an AIDS-free generation.
10 years ago, AIDS was a death sentence, stalling economic development, targeting youth in their prime, threatening the security of millions.
We were in the midst of the period of denialism in South Africa. We were working very hard against an administration that was pushing back. And then Durban 2000 highlighted this difference between the North having antivirals and the South dying of AIDS.
Most distressing was the fact that by that time, there were some drugs appearing in the developed world. AZT was the first, and then there was a sequence of drugs. So we knew that there were drugs available which could treat these infected children. And we just had no access to them.
In 2003, the United States launched the President's Emergency Plan for AIDS Relief, PEPFAR. The story of PEPFAR in South Africa begins as an emergency response to a devastating epidemic that was sweeping through the country.
Many people would agree that George Bush was really very visionary. Unlike anything that probably had ever been done before in terms of international global health contributions, PEPFAR was this. PEPFAR saved hundreds of thousands of lives.
This comprehensive plan will prevent 7 million new AIDS infections, treat at least 2 million people with life-extending drugs, and provide humane care for millions of people suffering from AIDS and for children orphaned by AIDS.
PEPFAR was given the head start it needed to provide support and expand existing platforms and programs.
Kudos to the American people. They stepped in when we had people dying in queues. They helped us save literally millions of South Africans.
The difference is visible every day on the streets of South Africa. Hundreds of thousands of people have had their health restored, like my health. After 17 years, I live a full and vigorous and active life because of antiretroviral treatment. My treatment is paid for by my medical insurance, but for many millions of other people, it's PEPFAR money that has made that difference.
PEPFAR has invested $4.2 billion over the past decade in prevention, treatment, and care for those with HIV/AIDS, and to increasingly strengthen the country's health system. PEPFAR represents the largest foreign assistance initiative by any nation in history to combat a single disease. U.S. investment increased to over $500 million between 2008 and 2011. As the South African government increasingly funds and manages the HIV response, PEPFAR funding is planned to gradually decrease. Working towards the goal of an AIDS-free generation has led to the following achievements. More than 2.4 million HIV-positive individuals on ARVs. Reduction of mother-to-child transmission down to less than 3%. More than 38 million individuals received HIV counseling and testing. Over 624,000 men circumcised as part of prevention. More than 477,000 orphans and vulnerable children receiving care services. PEPFAR's early response to the crisis in South Africa was the catalyst that sparked the rollout of hundreds of projects and programs throughout the country with strategic partners. What started out as a critical intervention steeped in compassionate action today leaves a legacy of cooperation, collaboration, and sustainability. The impact of PEPFAR is a lasting legacy that leaves a strengthened health system and broadening access to health care, with HIV/AIDS a manageable chronic disease.
It was an extraordinary initiative, and it suddenly made possible what people had thought was impossible to do.
The United States of America will remain the global leader in the fight against HIV and AIDS. We will stand with you every step of this journey until we reach the day that we know is possible, when all men and women can protect themselves from infection, a day when all people with HIV have access to the treatments that extend their lives, the day when there are no babies being born with HIV or AIDS, and when we achieve at long last what was once hard to imagine, and that's an AIDS-free generation.
I don't think we'll have arrived here where we are without PEPFAR. At the moment, we are tipping the scales. We are not claiming by any means that the HIV pandemic is over in South Africa. We still have a long period to fight, but we have turned the corner.
PEPFAR, partnering for an AIDS-free generation.